Michael, thanks so much for joining us this week. Happy to have you on the show.
Thanks for having me.
I realized that as I was getting ready for our time, that like you and I spent a lot of time working together, and I talk to you regularly and often, but I don't know a lot about you as a person. So I know that you live in Maryland, but did you grow up in Maryland?
No, I actually grew up in Massachusetts, in Western Massachusetts, Springfield, and lived there, through high school. I wound up in the Maryland area because I went to college in Washington D.C. In '87, and wound up staying in Washington. I met my future wife there. We lived in D.C. until I think 2001, 2002, and then moved to Baltimore. So I've sort of been a mid-Atlantic creature, ever since the mid '80s. But no, Massachusetts is still very, near and dear to my heart. My mom still lives in Western Mass, and we have a clinic in Springfield. So I know the area and I know that clinic very well. But yeah, I've been away from home, which, gosh, is that like almost 40 years? Gosh, it's a long time.
Yeah,
Yeah.
yeah. Uh, so you get to go back a lot, but what brought you? You went to college in DC. What
Yeah, I
what
went to
inspired
Catholic
you?
University in Washington, D.C. It was interesting because I had the opportunity. I applied to Boston College. I got into Boston College, and it was a really good school. I was really excited about it. But my older sister, was living in D.C. at the time. She just graduated college, was working for the Environmental Protection Agency. So I went to visit her in DC, and I just was fascinated. I fell in love with the city, sort of just everything about it. Not just the seat of government, but it was just like all the monuments, and it was just like really alluring. And so I went to a school that no one's ever heard of, really. I usually tell people I went to Catholic University in Washington, D.C., and they say, "Oh, you mean Georgetown?" And I'm like, "No, I didn't go to Georgetown." But yeah, and that's kind of how I wound up there. I fell in love with the city, and I kind of wanted to get out of my comfort zone, kind of thing.
Yeah,
And lo and behold, I've been there pretty much ever since.
that's great. You mentioned older sisters. You mentioned your mom. Were those your kind of your big influencers as you were growing up?
Yeah, well, I have two older sisters, 5 and 6 years older. So, I always looked up to them, and they took care of me as like the little, brother. So absolutely, I mean, from everything, like I got my first paper route when I was 8 years old because I took it over from my sister who was going to college and not college, but going to high school and couldn't do the paper route anymore. So yeah, my sisters were a really big influence. My mom, my dad. I was a child of the '70s, and so it was very different. It was like, you know, we had we didn't have color TV, I don't think, until my sophomore year of high school. So it was really like get up in the morning, get on your bike, ride to school, ride around the neighborhood, and then rush home when your mom, is driving around the neighborhood screaming your name, saying you're late for dinner, kind of thing. But yeah, my sisters certainly, my mom, my dad, yeah, it was, kind of like it was a very what you would expect of as, a whole cadre of kids. Like I would get on the bus. I think there were like 26 kids at my bus stop in our neighborhood, and they had busing in Massachusetts, so we went to like a community school. Yeah, and it was like, it was just always outside, regardless of the weather, the time of year, and not a lot of like parental supervision. My mom was a teacher, so we were all latchkey kids. So that same experience of coming home at 3:30, starving, and finding like nothing in the cabinet and making like jelly turnovers with Bisquick and grape jelly, or like, just, that kind of thing. It was like, it was like you would expect.
I'm laughing as you're describing these because it reminds me so much of my childhood. My dad had a whistle, and so he would just whistle, and we would come from wherever we were in the neighborhood, and we'd come from backyards, other people's houses,
Yes, that's
the
exactly right.
the open space behind the house. We'd hop the fences and come back home. It was just like,
It's so funny you say that because like when I was late and my mom got really mad, she'd get in the car and drive around, and my friends would warn me she's like screaming down the street in her like 1972 Monte Carlo, and I would hide in the bushes and say, "Hey, don't tell her you haven't seen me." And then I would race her home by jumping the fence and like getting in through the back door, and try to pretend that I had been home all along. It didn't always
yeah.
work, but yeah, that's the way it was. Like Either that or if it got dark, when the street lights
Yeah.
came on, you had to be in,
That was the time. Yep. Yeah.
Yeah.
Oh, that's so interesting. So your mom was a teacher,
Yeah.
and is that what drew you to education? Is that what got you interested in?
Yeah, I think to some extent, we were, because she was a teacher, she taught elementary, and then she went on to get her master's degree in ESL. And when she did that, she kind of got moved around the city by the district. And so my first couple of years, I didn't go to my neighborhood school. I just would get in the car and go to school with her. So
Mm,
yeah, I spent a lot of time growing up, like, decorating, cork boards in the hallway in the
yeah.
classroom and then pulling them down. And, whenever like my sisters were busy, I would have to come. I would go to her with like if there were staff meetings after school, like all my friends got to go home early. I had to wait until, my mom's staff meeting was over at 4:30, that kind of thing. So yeah, that was definitely an influence. I would say another influence, I had really great teachers, even from like elementary
Mm,
school. Um, and I just always looked up to my teachers. Even I can remember like my first grade teacher and second grade teacher, Mrs. Frazier. I had really, and because I had a mom as a teacher, I remember in second grade, I was just really quick at doing my addition and subtraction problems. And so she just decided that I was too, and then I would become a self control problem because I would
yeah.
start talking. And
Yeah.
so she thought I was so advanced, I should go upstairs with the third and fourth grade. And so I did. And I was handed this workbook with like multiplication and division, had no idea what it meant, was just guessing my way through, totally intimidated by all these older kids. So I went home and told my mom that night that I got moved upstairs for math. And you would think, and I said, I don't even know what this means. Like, what is a line with a dot on the top and the dot on the bottom? And you would think she would call the school and say, my son's not ready for that. But because she was an educator, I got a crash course in division that night for like an hour, and I stayed in that math class. But yeah, and then in middle school, we had a New North Community School, which was like this great school, was relatively new concept with we had all these like we had pods as opposed to classrooms. So we had 100 students in a pod in like 4 sections, and we had like closed
Mm,
circuit television. So like the kids would put on like a news show every morning, and all the kids in the other pods would watch it. We had a planetarium. We had a like Olympic sized swimming pool, piano labs. It was just like it was really wild. I had great teachers there, some of whom I, stayed in touch with. Unfortunately, most are passed away now, but and then even in high school, I had really inspiring teachers. So I always loved school. I was never one of those kids that was like,
yeah.
"Oh, I can't wait for a snow day," kind of thing. Although I did like snow days, but I did love school.
That's so interesting that just hearing that story, it's like, oh yeah, again, just the parallels between your childhood and mine. Like I'm thinking, oh yeah, I think I still know my first grade teacher, second grade
Yeah.
teacher, like some of those early ones, and then of course the ones from high school that stood out to you, right? Like those are you'll
It
tell
is
me more.
amazing, right? Like 40 years later, gosh, for me, almost 50 years later, I can still rattle off. I mean, it gets hazier and for high school, and I don't think I can name one college professor, but I can name you almost every elementary school teacher. I can name, the woman in charge of, drama and art department and the plays I was in. I can remember that my fifth grade music teacher, Mr. Gaminsky, suggested that, when I told him I might quit the clarinet, he said to me that I think that's a good idea. Like so like all these things, yeah, like those it's just wild how you can maybe it's because your brain is far less muddled with everything at that point and things are more impressionable. So they just stick there. I always like to use the analogy of like a computer hard drive and like those things are like down in the hard drive stored.
Yeah.
And then I find myself, forgetting the passcode to my computer 3 times a week. So, maybe
Right.
I've used up all my hard drive. I don't know.
We've got a system for that. Well, I'll tell it to you afterwards.
Right.
So I gotta ask, right? I hear about your childhood and some of the influences and like the draw to education. What prompted you to start Learn? And at that time, it wasn't even called Learn, right? What tell us about that chapter.
Yeah. So, it was interesting. You know, so as a result of like I really loved English. And so I decided to be a major in English in college. And it made my mom cry. 'cause she thought that I would never be able to earn a living because it wasn't like a practical, thing. And then I think it was at my after my sophomore year, I went to visit my sister who was in the Peace Corps in West Africa, and I spent like 3 weeks with her in, a little village, and I became fascinated with oral history, and just the oral historian griots of West Africa because there's no written history. So I decided I came back and I'm like, I'm going to major in anthropology and I'm going to write my thesis on West African oral history and griot history. And my mom cried again because she thought, what could be worse than anthropology than that? So I, and then I graduated and I was like, I'm gonna like go try to use my major some way. And luckily I was in Washington, DC. So I got an internship at the Smithsonian Institution in the Office of Folklife Programs and Cultural Studies. And they did a lot of things. They put on a national sort of cultural festival on the mall every year, and they featured a couple of different countries and different cultural traditions. And so that was very quasi educational. We would put out all sorts of informational and educational packets that we would send to school districts. And so that was sort of my entree. We also ran a record label called Folkways Records that had a lot of old spoken word and blues and jazz and folk music. And we would reissue it on a CD. We had all these educational packets for music education that we would sell into school districts. Um, and so I was sort of like, okay, I'm using my major. I really enjoy this. And it was, I guess, around 98 or 99 that I got recruited to go work for this education startup, this internet startup. This is back, for some listeners, like they were born after the internet. I remember when the internet like became commercial in 1990, three really. But so in 99, I went to work for this startup and it was, the whole idea was it was going to be sort of like a gated community online for educators, teachers, students, and parents. So teachers could post homework help. Students could go online and get homework help and, chat with their teacher or with their classmates. Parents could go online and get their grades and other things like that. And that kind of catapulted me into like the education industry, if you will. And then that company was sold to Sylvan Learning Systems, I think in like 2001, maybe. And when I went to work at Sylvan, I was in the institutional services division. So we were contracting with public school districts to provide intervention programs for struggling learners, mostly with
Mm,
Title I money.
okay.
So I was working with school district administrators all around the country to design programs, either pull-in programs or after-school programs with an academic component. And that's kind of really how I got into it. And then it wasn't until Sylvan sort of sold our division that I kind of decided that, I think I can do what we did at Sylvan, but I think I can improve on that. One of the things that always bothered me about those intervention is they tended to be homogenous based on grade level as opposed to individualized. And so
Mhm,
I connected with a guy I knew who was willing to kind of fund us building out an assessment system and purchasing and developing curriculum. And then, we went and got contracts with school districts and we grew really rapidly because we were focused on like individualized instruction that was really tailored to what the gaps were in students learning, all kind of tied to grade level in each particular state, as opposed to having a student in a small group learning what they already know. We could create individualized instruction in a very small group at different levels. And so
mm,
everybody that was in that program was getting it was a way to kind of accelerate tutoring in a very targeted way. And that's really how it began. And from there, we continued to expand. And it wasn't until around 2010, 2011, we started to look at the needs that school districts had for special education programs. It started with a shortage of speech pathologists. And so we began to develop a program to do tele speech in a school setting. In fact, Laura Lazar, who's still with our organization, she recorded this how-to video based on a contract we have with a rural school district in Nevada on how to do effective tele speech in a school setting. And I think it's still on the ASHA's, American Speech and Hearing Association's website as an instructional video on how to best deliver, telespeech in a
Right.
school setting. Yeah. And then from there, it just grew, and it was always a response to school districts' needs and challenges. And so, as more and more kids were getting diagnosed as being on the autism spectrum, it was sort of like, hey, do you have any interventions, and what can we do? And we're like, well, let's, it was mostly very consultative, and it kind of just grew from there, really.
Yeah. Yeah. And now across the nation, 17 states?
Yeah, well, if you count, we have our autism division and our learning academy I think if you count both, it's 24 states. Yep,
Okay. Okay.
24 states. But yeah, it's, you know, um sometimes it's kind of mind numbing to think that, but it didn't like sort of happen overnight, right? It was all through incremental steps and two steps forward and one step back, that kind of thing. But it really is a matter of just kind of evolving and identifying where there's a need and where there's demand, and then trying to customize a way to kind of meet that demand.
So over the last, what you said in 2010, since then, right? The landscape of how individuals are getting support has really shifted, right? And now there's a lot of ABA services that are happening. We haven't been able to dive into that in our conversation just yet. So how have you seen the field of ABA shift in the last 5, 10 years?
It's crazy. It is an absolute sea change. I think when we first started looking at kind of out of school interventions and ABA, call it like 2011, 2012, I think maybe 4 states covered the benefit.
Yeah.
I don't think there was any Medicaid coverage for
Right.
interventions with children on the autism spectrum. And then if you fast forward to today, all 50 states have reimbursement. So they pass laws that require, if a commercial insurance plan like Blue Cross Blue Shield or United Health or Op, if they want to operate in that state, they must cover this benefit. That's a huge change. Parents, used to have to come out of pocket if they could afford it. Very few could. A couple of states, California being one, Massachusetts another, were very progressive and had um, funded programs through Health and Human Services departments, but it was limited, right? And so just the pure access to care has just ballooned. And then the financial burden that most parents feel, as a result of a diagnosis, like that has been lessened pretty dramatically as well. So that sort of like, that lobbying effort was pretty significant. And then, in terms of, you know, along the way, state agencies, insurance plans, state Medicaid directors, all of them are kind of navigating along with us, trying to at least
Mhm.
understand what this treatment is, how it's beneficial, how they should view it in terms of intensity. We found over the years that, and this better than most, is like we find ourselves educating the health insurance rep, or even people in the state offices. I spent a lot of time, talking to politicians and legislators about the need, school district administrators, insurance representatives. So there is, I'm happy to say that 10 years later, the awareness is far stronger.
Yeah.
And it's not obviously just us. I mean, Autism Speaks has done a wonderful job building awareness. There are almost every state has associations for ABA that promote awareness. There's a lot of recognition now, and that just wasn't the case, say 10, 12 years ago.
Yeah, I think about myself and my social circle, right? 10 years ago it was, "Oh, tell me about what you do." And now it's people bring questions to me, right? It's a
Yeah.
sort of shift, right? Instead of me trying to be an advocate and communicate on behalf of the community, now people are saying, "I want to know more," and they come to us, right? And so I think that's a great thing that now more and more of exactly what you're saying, more and more people in the community, just the general population, know about what it is that we are trying to do, or other ABA companies or
Yeah, and I think you're the one that told, like, it's a like a b you know, 10 years ago or 8 years ago, if you told someone, like, if someone asked you what you do and you say, "I'm a behavior technician," or "I'm a behavior analyst," people be like, "What's that?"
What is
That
that? Yeah.
yeah, and now if you're like, on your playing on your, community softball team and you say, "Hey, I'm a behavior technician," people know exactly what that is,
Right.
and so I think that whole like that awareness, certainly has transformed, access to care and things, and that's like a huge change from, going back 10, 12 years.
So what do you think is coming in the next 10, 12 years?
Oh gosh. I couldn't pretend to have a crystal ball.
Yeah.
I do think that we're kind of seeing it now where as, the payer landscape starts to understand this treatment and the impact, I do think they're going to start to try to figure out what constitutes good outcomes, just like in any other healthcare practice. And so I think that is going to kind of continue to evolve. I think, the as people always say, if you met one child with autism, you met one child with autism. I think
Yeah.
the reason there's not like more defined outcomes frameworks currently is just because it is so unique, and the interventions are so unique to each child and each family. But I do think there'll be more of trying to identify what constitute on a multi-measure, because payers need to understand who's providing good treatment, who's, getting their children to make progress. That's going to be very important, especially as, the amount of money being spent on these interventions continues to rise. And, we've seen that in a handful of states where they're starting to say, wait a second, my reimbursement for this, has gone up 400% in the last 3 years. We need to figure out what are we getting for this additional spend. And then I think the other thing is there's a constant evolution of care, like whether it be, regulations, requirements, but also additional research, studies and data, innovations in the delivery of care, automation in terms of like some of the back office work that needs to be done to, you know, get an authorization and bill for services and track it. I think there'll continue to be, innovation in that regard, and I think it's gonna be interesting to see how it evolves. I can't as I said, I can't really predict it, but,
Yeah.
there will absolutely be, just like there is in the education sector, with, Saul Khan's new Conmigo, platform, which I heard a school in Arizona is gonna start to implement. I think there's always gonna be those innovations that go along. But I don't think it'll ever replace like the one-to-one treatment. There will be tools that behavior technicians and behavior analysts can use to improve their treatment, improve data analytics. But that it's the one-to-one is so critical to care
Yeah.
that and development that I don't think that will change. But certainly setting of care, tools that we use, all those things are continuing to evolving.
Yeah. And I think also there's going to be a shifting in the landscape of access, right? People are going to have different access in different places, right? Just based on
Yeah.
where they live, right? I think
Yeah.
it's going to change. It is interesting though. I'm hearing from you the history of the benefit of everything being individualized and your draw for things to be individualized, and now how it's changing, and we've got to be able to measure some outcomes and be able to show that, and it's hard to do that when you've individualized, right? And just noticing a trend of the past and the future, right?
Yeah. Well, if you think about like what you and I talked about earlier, like at least for me, like how impactful some individual teachers were, some individual coaches in my life and other, mentors. And so I think like that is, I think so important in terms of human development is that like, that human connection. But you're right. You know, that's the one, challenge we have over the course of the next couple of years is to ensure that the agencies and the insurance companies that reimburse for our services don't attempt to kind of put it in a box. We've seen
Mhm.
this over the last several decades with the attempts to sort of standardize testing, and evaluate, the success or failure of a school or a particular teacher or classroom on a standardized test. That's one measurement, but there has to be multi measurements. There has to be a kind of a holistic look at how this intervention is kind of improving that family's life or that child's life, and how they're meeting with successes and how they're changing and growing and evolving. Like, it can't be kind of boiled down to like one measurement or one test.
Right. Right. Yeah, it has to be multimodality, right?
Yeah. Yeah.
Yeah.
It really, and I mean, it eventually there will be, less funding available, right? Like there will be more people receiving services. And so it's going to be interesting to see how the payers kind of prioritize this treatment. And so it is important to have these outcomes and this data. There have been a bunch of studies, obviously, that demonstrate the impact. But I think they have to kind of keep coming, and I think that to some extent that's our responsibility as providers, because I don't think the payers are going to kind of come up with it on their own, nor do we want them to, right?
Right. Right.
We want them to understand that there's a whole battery of indicators that can demonstrate whether or not a child is thriving, you know?
Yeah. So, Michael, of all the things that you've done, what's been the most rewarding part of leading Learn and leading the organization?
To be honest, like there is a lot of reward, obviously, in seeing students and families and kiddos thrive and, hearing about the stories of their successes and things, and how they're making progress and building competence. But, also I find it very rewarding that we can create opportunities for talented professionals to come together and really pursue their passion for supporting young people and thrive as well. I always say, I view primarily my job as doing everything I can to provide the resources necessary for our talented clinicians and educators to do the work that they do. And so I think to me, building a network of professionals that are able to do this work and able to collaborate and able to have an impact, that's probably the most rewarding.
Mm.
And obviously, the outgrowth of that is if you have very talented, caring individuals, working every day with our most vulnerable population. That feels really good.
Yeah. Yeah. Michael, we're almost at the end of our time. This has flown by for me. Thank you for giving us the time to do this.
I told you we talk a lot. I'm sorry.
No, this is great. I love it. I love it. But when you mentioned over the next couple of years, right? There's some things coming. What's something that you're excited about? What's a change or an opportunity that you're excited about in the next few years?
Oh gosh. Well, I think, there is, I think opportunities, and this is going to sound a little bit dull, but for me, like my lens is always, trying to make the client experience better, but also our professional experience better for all of the clinicians and educators that work for us. So I do think that we're on maybe hopefully a precipice of improving kind of like the administrative workflows, and just automating some things that are right now probably pretty tediously manual. And so that takes a lot of different forms, whether it be improvements in software to track data collection or improvements in software, in practice management systems, scheduling, all of these things, billing and collecting, a lot of the administrative work, and some of this ties in with this outcomes, that, like you and Rob and your team are working on, is if we can kind of convince a payer that, a value-based care, kind of framework is best, where we can, you know, essentially commit to a set of care, regimen in a particular time period, and then kind of commit to those outcomes that we expect. Think about like the amount of like administrative paperwork that would reduce.
Yeah.
So it's not like a super sexy answer, but I think everyone will attest to, like, regardless of whether or not you have a child that receives ABA, like everybody goes to the doctor, everybody knows how confusing it is. I get bills for a visit with a copay that I know I don't owe, but then you're like, maybe I should send it. And then you get a collection, and then you're like, well, wait, what is this? And it is very, very administratively burdensome, even for like the end user. And so I do think a lot of the innovations that are happening in technology, I think can really, make the client experience better and certainly make, make our staff's lives better.
I think those are challenges across the medical industry as a whole, right? I mean, how much time do doctors and specialists and nurses spend doing administrative tasks of taking notes and doing other things that impedes them being able to actually see patients and clients?
I just
And
had well, the reason I couldn't like, we were scheduled last week, I had a root canal, and as I sat there after it was over, the endodontist and his assistant were typing in and complaining out loud to me about all the notes that they had to submit to get reimbursed. So you're right, it's across the board, whether it's dental care, behavioral care, hospital visits. I mean, it is a real challenge. It's one of these things where, and you get treatment ahead of payment. And that would seem very convenient, but at the same time, if there's no transparency in that, then you are surprised later, or, so it is one of those transactions due to the nature of the sort of urgency of the care most of the times where you can't stop
Mm.
if someone has an urgent situation and say, okay, well, let's cover all the possibilities, and we're talking about, human health and well-being. And so it's very complex, I mean, if it weren't complex, it probably would have been solved already. But I do think with the aid of automation, it could certainly get easier.
Oh, interesting. Interesting. Well, thank you so much, Michael. Appreciate your time. Appreciate the work that you're doing. Appreciate you spearheading all these ventures into the future for us and for the autism
And
community.
I appreciate you and all Autism Talk. This is great. I'm honored to be on it.
Well, we're
So,
happy to have you back anytime.
well, thanks so much.